Good morning, everyone. Welcome to our weekly COVID-19 media briefing. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. We will start with the numbers. As of yesterday, we have had 11,389 confirmed cases of COVID-19 in Shasta County, including 7 from Sunday and 17 from Monday. We have done a total of 177,377 tests. We have 9 people hospitalized in Shasta County. That is an increase from last week, but there are still no people in the intensive care unit as of yesterday. We have had our regional ICU capacity is at 33.1%. That changed with the weekly update yesterday. And we have had 204 Shasta County residents who have died from COVID. With us today, we have Robin Schurig, the Director of the Public Health Branch of the Shasta County Health and Human Services Agency. Karen Ramstrom is the Shasta County Health Officer. We have Dean Germano from Shasta Community Health Center, Robert Folden from Mercy Medical Center, Redding, and Mark Mitchelson from Shasta Regional Medical Center. Thank you everyone for being here. And Robin, would you like to start us off today?
Sure, good morning. Let me pull up my notes here. I have the latest tier assignment data to share with you that was announced yesterday. And I'll also share a brief update on state guidance that has been released and state guidance that is coming. I'll start with the tier assignment data. We continue to be in the red tier. Our case rate increased from 4.5 daily cases per 100,000 population last week to 5.1 this week. This seems like a small increase, but it's what's preventing us from moving to the orange. With our test positivity at 1.8%, which is the same as last week, and our equity metric at 1.9%, down from 2.1% last week, both of those are now in the yellow, which would mean we could move to the orange if our case rate had decreased, stayed the same, or increased by no more than 5%, but it increased by 13%. So we are staying in the red for now. So again, as long as our test positivity and equity metric remain below 2%, if our case rate stays about the same or decreases for 2 weeks, then we'll move to the orange. Or if our case rate decreases to less than 4 and stays there for 2 weeks, we would move to the orange, even if our test positivity and equity metric were as high as 4.9%. And if that wasn't confusing enough, there's also the possibility that the tier thresholds will change as early as next week, because statewide, we're getting close to hitting the 4 million mark for vaccines administered in the lowest quartile of the state in terms of advantage, or the areas with the most disadvantage. So the state has said that once that 4 million mark is achieved, the thresholds will change. And at that point, the threshold for moving from red to orange changes from a case rate of less than 4 to less than 6. So even if our case rate stays the same or even increases a bit, we could still qualify to move to the orange once that threshold change happens. We would still need to meet the criteria for 2 weeks before we would move. So we're looking at April 14th at the earliest for being in the orange. As I've mentioned before, because more and more people are getting vaccinated, and now because vaccine will be available to anyone 16 or older who wants it as of April 15th, the state has released some new guidance and is working on more. The guidance that's been released recently is for outdoor seated live events and performances, graduations and commencement ceremonies, and amusement and theme parks. They're working on guidance for fairs and festivals that they've said will be very similar to the amusement and theme park guidance. They're also working on guidance for indoor events, gatherings, both outdoor and indoor, and private venues and events, both outdoor and indoor. They also said that they would be announcing more details on the concept of a green phase as soon as early next week. It will go into effect at some later date, but they're going to hopefully provide more details early next week. So again, what they've said so far is that this would not be another tier in the tier system, but rather what comes next after the tier system is no longer needed. So we look forward to learning more about that next week. And that's all I have today. I'll turn it over to Dr. Ramstrom.
Good morning, everybody. So I think we're all really excited to see the case numbers and hospitalizations down. So that's great news. This little bit of a reprieve provides us a window to protect our community from future surges and from the vaccine, the COVID-19 variants from taking hold by getting vaccinated. And this includes people who've had past infection. We want to really maximize your immunity to protect yourself from variant strains that may be emerging in the future. These vaccines are an invaluable gift. We have plenty of supply in our community right now. We have a lot of appointments. And the vaccines have been shown to be safe and effective, not only in the vaccine trials that have involved tens of thousands of people, but in real world use. More and more studies are coming out, that have evaluated the millions of Americans who've been vaccinated now through various studies and national surveillance systems, including those who compare people who've been vaccinated to those who have not. We know some people continue to have questions about the vaccines, which is completely understandable. And we encourage you to talk about your questions with your family, with your physician, with your friends, with your clergy, whatever trusted source that you normally talk to when you're trying to make decisions, and ask them about their experience and seek out, reputable sources for information on these vaccinations. We have a lot of appointments available at ShastaReady.org, so we encourage you to go there frequently. In terms of eligibility, starting tomorrow, so right now you could go online and sign up. Individuals 50 and older will be eligible. And all ages, as we've said before, people with medical conditions or disabilities, or people in certain sectors, including healthcare personnel, educators, childcare, emergency services, and food and agriculture. Those are all ages. In addition, as of last week, family members of all eligible groups are able to get vaccinated as well. You go with your eligible family member and you can get vaccinated. We're also considering opening up to individuals 16 and older very soon, perhaps even before the April 15th date if we have vaccine appointments available. So stay tuned about that. And we'll make that information available in terms of the appointment slots at ShastaReady.org. Happy to answer questions.
All right. Thank you, Dr. Ramstrom. Do any of our healthcare providers have anything you would like to share this morning?
I guess nothing necessarily COVID related, but I will mention that, we celebrated Doctors Day yesterday. And certainly this last year, our work couldn't happen at all if it wasn't for our physician partners. But I got to tell you, this last year, we've had so many people step up in huge ways that it's just nice to be able to recognize them in kind of a different fashion. So anyway, happy Doctors Day.
All right, Dean or Mark? Seeing none, we second that. We appreciate our fantastic health officer and Dr. Vivakis, our deputy health officer, and we have a number of psychiatrists and psychologists who have also really stepped up and had to do things a lot differently in the past year than they have before, and we appreciate all of their hard, excellent work to keep our community safe. We are ready for media questions.
Hi, good morning, everybody. Happy Wednesday. It's Anna here from Channel 12. I just wanted to ask, earlier this week, the CDC director, went before some other government officials, and she was urging them to, not let up, saying something like impending doom. And then another UCSF doctor said that she's not too worried about a fourth coronavirus surge. From Shasta County public health standpoint, is there a concern of a fourth surge happening here? We've seen it time and time again when people get together and all that stuff.
Yeah, I would say we have seen our case rate increase recently, and so we're hoping that that doesn't continue, but it is concerning that, numbers were going down for quite a while, and now they're looking like they may be starting to come back up again. I think some of it has to do with just some of the restrictions loosening and people being more comfortable going out and doing things that they maybe wouldn't have done over the course of the last year or so. So we are concerned about that. We're also a little bit concerned that even though vaccine is becoming more and more available, there are, segments of our population who are not interested in being vaccinated. So we're working on messaging to try to encourage people to get vaccinated when it's their turn and when there's vaccine available for them, and to address the concerns about, safety and other hesitancy that people may have. So for those two reasons, I think we are concerned that there could be another surge, but we just have to wait and see what happens.
Thank you, Robin. And then another question I had was that today Pfizer also mentioned that their vaccine was effective in youth between the ages of 12 to 15 years old, I believe. from public health standpoint, will you be considering also administering the vaccine to that age group?
So like all vaccines we use, we wait until there's federal authorization for their use. And so just like we've done with all the other vaccines that have become available, we'll wait and see what comes out from the FDA and the CDC.
Thank you, Dr. Randstrom. And then I just also wanted to ask a couple things too. So you mentioned, you could be looking to open up the 16+ age group before the April 15th date. Like, how would that work? Would it be like Butte County, where they would have to still go through My Turn, click the 65 to 74-year-old age group? Like, how would that exactly work out for Shasta County?
You're right. We would have to work with the My Turn folks at the state level to set up our clinics to actually allow those individuals to sign up, and they're willing to work with us to do that. We're just kind of watching our appointments, and we want to make sure that these new groups that are added, so individuals 50 and older, have an opportunity to get vaccinated. And so we'll see what the uptake is for those appointment slots, and then work with the My Turn team at the state to adjust our enrollment and eligibility within our appointments accordingly. And so it will end up looking a little bit different in terms of eligibility when you go into the My Turn system.
Dr. Randstrom, I have a question. Last week you announced that there was at least one case of the B117 British variant. Do we have any other evidence of it being being seen here?
We haven't had any additional variant results come in. I can't tell you how many results we've received. We're sending some specimens on a regular interval. And I've actually just asked about that, like how many have we sent and how many results have we gotten back, because the state and the federal capacity for testing those is really just now getting ramped up. And so no additional variants identified yet, but I also don't know if we've gotten more test results back.
And then, sorry, Anna here. I had another question again for Robin. You mentioned that the tier changes could be changing. What would that look like once California reached that 4 million vaccination mark exactly? Would they look like the tier system? Like, how would that differ from the tier system we're seeing now?
So the tier system itself would stay the same as far as what restrictions are in place in each of the 4 tiers, yellow, orange, red, and purple. But the change is the thresholds that it would take in terms of the case rate that you would need to have in order to move from one tier to the next. So they already changed the threshold for moving from purple to red when we hit the 2 million mark. And then once we hit that 4 million mark, then they're going to change the thresholds for moving from red to orange and orange to yellow. But the content of the tiers doesn't change.
Okay, so just to clarify, so like you mentioned, instead of it being like the number like 5 case rates per 100,000, I believe, like you said, it would be like 6. That would change the qualifying, qualifying, I guess, to move into the next year.
Correct. So your case rate would just need to be less than 6 to move from red to orange instead of needing to be less than 4.
Okay, thank you for that clarification. And then I also had another question. The Reading Rodeo is coming back this year. Do they fall under like the new guidelines of live entertainment, or are they still having to follow like outdoor sports guidelines exactly? What about them?
So it's a little bit of a combination. They are still considered a professional sport. So in terms of the restrictions that are in place for the athletes or the performers, the professional sports guidance still applies. But when it comes to having spectators attend the rodeo and, selling food and things like that, they do fall under that live performances and events guidance. So that has opened things up a little bit more for them in terms of being allowed to have people attend in the red tier, and then how many people they can have attend if we were to be in the orange or the yellow.
Thank you. And I think that covers it for me. If any other reporters want to jump in.
Yes, Dean's question had prompted my memory about something that was brought up in one of the daily updates. The variant, it was mentioned, may be restricted, maybe resistant to the vaccine. Is there any more evidence of that?
So there's a couple of the variants that are being watched closely because there's concern about the impact on vaccination efficacy. The Janssen vaccine actually was studied in the countries where those variants were circulating, and it has shown to decrease efficacy, but the efficacy has been so robust across all of the vaccines, even in the lab for the mRNA vaccines. The response is so robust that it still provides adequate protection, but that's something that's being monitored closely just so it can inform future vaccine development and disease control measures. And that's why the state's doing additional surveillance for identifying these variants so we know how to respond.
Another unrelated question, Dr. Ramstrom. Did we accidentally defeat the flu this year?
Right. So all of the prevention measures. So if you're not around as many people, you're not, you're wearing your face covering or your mask, you're washing your hands a lot. All of those things protect against other respiratory viruses as well.
Thank you.
Any other media questions? Okay, I have a few questions from the public that I will go through right now. What precisely is Public Health HHSA doing to address any, oh, sorry. I wanted to start by saying that we do receive a handful of questions in our COVID-19 inbox, and those are the questions that we read here. We have answered every COVID question that has come our way. Sometimes we do distill that question down to the actual question. People have the opportunity at the Board of Supervisors meeting to state their opinion for 3 minutes at a time. This format is for answering questions. So I do distill the questions down into an actual question. So I just wanted to make that clear. And distilling it does not change the question itself. So I just wanted to make sure that we were clear on that. So what precisely is Public Health doing to address any spike in vehicle accidents, just like DUI or cell phone driver distraction as public health hazard for those driving impaired from the new experimental gene-altering biological vaccine?
I guess I can take that one. Providers ask patients to wait for the 15 or 30 minutes, depending on their history, which is recommended by CDC after their vaccine to ensure that they don't have a reaction. Anyone who doesn't feel safe to drive for any reason shouldn't be driving, and there have been no known vehicle crashes related to vaccine administration in Shasta County.
All right, thank you. This question was asked last week, but I was asked to ask it again, so I will do that. Does wearing a mask contribute to bacterial pneumonia?
So last week I had said no, so I could elaborate a little bit on that. So it's still no. People should, wash their hands after wearing their mask, and ideally after each use. And washing their masks frequently is recommended by the CDC and California Department of Public Health. And your mask is only going to have the germs that you've contributed to that mask through your breathing or your hands or whether you've laid it around somewhere. So we don't recommend that, but that's the only way that bacteria would be there, and that's not the normal way that bacterial pneumonia is, that we worry about acquiring bacterial pneumonia.
Thank you. Is Shasta County HHSA Director Donnell Ewert attending below for special reasons or depends on other circumstances? What is his precise role, task, duty of his COVID-19 participation in BOS meetings and media briefings?
So I can take that one. Donnell is the agency director. He's the director of the Health and Human Services Agency. So he oversees all of the activities within the agency, including public health and including the COVID response. He interacts regularly with the incident command team, which is, I serve as the incident commander. I have a deputy incident commander and then Karen as the health officer. So he interacts regularly with us regarding the needs and priorities of the COVID response. We are the direct leaders of the response and are best suited to present information and respond to questions at both the media briefings and the Board of Supervisors meetings, but Donnell is able to fill in for us if we are unavailable. And I'll also just add that there was a time period earlier in the response where he was more of the public face of the response and of public health because the public health director position was vacant at that time. So since I moved into that role in September, I've been doing more of that and he's been stepping back.
All right, thank you, Robin. When will you post the weekly CDC VAERS death report link on shastaready.org? The CDC, as of March 26, 21, has just crossed 2K deaths reported, and this might be only 1 to 5% of reports. So if not listing the CDC site, why not?
So I would just say, I mean, we have a lot of links to CDPH, California Department of Public Health, and CDC on our vaccine pages, both under vaccinations and under the frequently asked questions page. I don't know if we link directly to the VAERS page, but it's pretty easy to Google and find that. So we recommend you check out the links at shastaready.org and go to CDC directly.
All right, thank you. This is another one from last week. We're going to try a do-over on it. When asked about the spike in deaths in mid-December, even though all metrics had decreased, I received an inaccurate response when you said a spike in cases happened in October that led to an increase in deaths in the time frame I referenced, but that is not accurate, as the case numbers in the time frame I referenced, mid-December to today, were/are decreasing while the rate of deaths has actually increased. Please address this properly. Are people just dying outside of hospitals now? Why would the deaths go up, but there are 0 in the ICU? And so I'm gonna use a visual to see if maybe this is helpful. And I know you can't see it from here, but I want to show it to you anyway, just so you know what to look for on the Shasta Ready website. On our data and statistics page, we've got this chart that shows cases, hospitalizations, and deaths on the same chart. And so as we mentioned last week, you'll see a spike in cases right here that started in October and peaked in late November and early December. Then there was a spike in hospitalizations in late December. Then there was a spike in deaths in mid-January. These are connected. The people that are in this spike were also in this spike and were also in this spike. Not in all cases, but generally speaking, that's how this works. So people test positive, then they later become sick enough to be hospitalized later down at a later date. And then sometimes, unfortunately, they later, after being hospitalized, die from COVID. So that's how that works. And it is not unique to Shasta County. That's how this has worked all over the world. And then the last question. Oh, sorry, go ahead.
Sorry. Yeah, sorry. I just wanted to add too, I think another chart we could put online is actually when the deaths occurred. So that might be confusing. So it can take a while for the death to get reported by the attending physician and to go through the process. We like to review it and make sure that the information's there, just like our regular process. And so that can take some time. And so the date that is reported doesn't have to do with the date the death occurred. It could have occurred a number of weeks in a varying interval. It can take a while to get those completed. Sometimes they happen more quickly than other times. So we can post that chart as well that helps make that more clear.
Yes, thank you very much for that clarification. The last question is, please provide the statute or statutes HHSA is operating under to allow them the control of people's oxygen, businesses deciding who is essential or non-essential, violation of First Amendment rights to worship freely, etc.
So I'll start by pointing out that the vast majority of restrictions and rules and guidance are from the state level, not the local, not from the Health and Human Services Agency here in Shasta County, but there is authority under the California Health and Safety Code that gives certain authority and powers to both local health officers for their local health jurisdiction, as well as the state health officer for the state as a whole. So section 120175 says that health officers are authorized to control communicable diseases and may take steps necessary to prevent and control the spread of disease within their jurisdiction. Section 120130 says, it provides additional statutory authority for isolation and quarantine. Specifically, that is something that is done at the local level. When we issue an isolation or a quarantine order, it is under the authority of our local health officer. And section 101040 says that the local health officer may take any preventive measures that may be necessary to protect and preserve the public health from any public health hazard during a state or local emergency. And so again, in our case, we have not issued any additional or more restrictive orders at the local level than what is in place at the state level. We have not issued any fines or closed businesses during this pandemic. And that kind of thing has been done in some other counties in the state, but it has not happened here in Shasta County. We simply follow the state's guidance that they issue and the mandates that they put forth.
All right, thank you, Robin. Those are all the public questions. Did anybody have anything else to add or any additional questions before we recess for the day?
Could I ask another question?
Sure, of course.
Dr. Randstrom, is the vaccination like measles or mumps, where it will protect me the rest of my life against coronavirus, or will this virus mutate to a degree by next year that my body will no longer recognize it as something to fight and I'll have to get another vaccine?
Yeah, so it's probably going to be a need for a booster or a new vaccine like we get every year with influenza. So, excuse me, sorry. So influenza changes much more than this virus. And so that's why we need the annual vaccination to protect ourselves from the new influenza strain. So similarly, it's thought that it likely will require an annual booster, but we don't know exactly what that's going to look like yet. All of the vaccine companies are sort of looking at that right now.
Thank you.
All right. Thank you, everyone, for your participation one more time. We will see you again next week, Wednesday at 11 a.m. Everybody have a safe and healthy week.